In this video, I want to talk to you about tennis elbow. What is it? How can you test for it? And most importantly, my 6 top tips that I think you need to consider and implement to ultimately get rid of tennis elbow. So let's go. Thanks for checking out this channel. If you're new here, my name's John. I'm the head therapist at John W Sports Injury. And here at this channel, we want to make sure that we can help you to understand your body, to remove or reduce your pain, to ultimately help to achieve your sport and exercise goals. So if you think that sounds like it's going to be helpful for you, why not subscribe to our channel, hit the bell notification, because I can keep you updated. And one more favour, as we're going through this video, if you think that this is helpful and is going to help you and good content, make sure you hit that like button. Hitting that like button allows me to see what's the most helpful type of content for you. So let's get going. Tennis elbow. Firstly, some myth busting. Is tennis elbow something that's only suffered by tennis players? Absolutely not. In fact, probably the majority of tennis elbow that we see in our clinics isn't actually with tennis players, although it does occur in tennis players. And I'm going to explain why throughout this video. But what we actually call the condition is lateral epicondylitis. And what it is a pain at the outside of the elbow. Why is this happening? Well, our muscles that bring about wrist extension in our forearm all come and attach onto one point on the outside of the elbow. That point is termed the common extensor origin, or it's anatomically known as the lateral epicondyle. So when we get a problem here, we get lateral epicondylitis. So ultimately, the problem comes about via dysfunction of these muscles on our forearm, the top part, the extensor part, that come in and attach into the outside of the elbow. So the pain happens here, but as per usual, that is what I term the effect. The cause is elsewhere. And that's what we're going to talk about as we make our way through this video. How can you test for it? Well, before I dive into this, I want to remind that really diagnosing of any particular pathology or condition should be carried out by a trained professional. But here is a quick and easy way that you might be able to have a see if you're indicating of this tennis elbow condition, if you're suffering pain in the elbow. All you do is place your hand flat onto something like a table or a desk, and what you want to do is then resist your finger, your middle finger in particular. If you look to resist it pushing up away from the table, and if that resistance causes a pain at the elbow, that's an indication that we might be getting tennis elbow. But most importantly, what we need to do is what you now need to consider if you're someone who suffers with pain at the elbow. My 6 top tips. Number 1, stretching. You want to make sure that you're stretching out these muscles that are pulling on the outside of the elbow. If those muscles are tight, they're going to create excessive force onto that elbow that we want to reduce. So I mentioned that they're wrist extensors. So to stretch, we go the opposite way and we take them into flexion. So we can place our arm directly in front of us and then look to pull that wrist down, holding that stretch for 30 seconds. And what you should be feeling is a release or a stretching sensation across the top of the arm. Do this 2 to 3 times, 30 seconds, repeat it multiple times throughout the day. Secondly, we can look to strengthen this. Now, in order to strengthen, what you can do is take something like a water bottle, works quite nicely. And you can literally start this exercise with an empty water bottle. Then as that becomes easy, you can start to feel at different increments, perhaps a third full, 2/3 full, and fully fill the water bottle to build that weight. It doesn't need to be a big weight because we're working small muscles. But what we can look to do is you can look to strengthen in both flexion and extension, so taking our way through, and that's what we would call a sagittal plane movement. And then we would also want to work into rotation, and you might find that this movement is a little bit more difficult when we're working in the rotational plane, or what we call the transverse plane, because that works multiple muscles and is a little bit more demanding of those muscles. But remember, start with an empty bottle. And the other thing that you can look to do is start these exercises with your arm over or supported by something like a table or a desk. Hang your arm over the edge of the desk, and then the table will be taking the weight and you'll just be moving through that wrist. As you progress, you can then move away from the table as it feels more comfortable. You might look to do about 10 repetitions of this to 12 repetitions for 3 sets. My third tip is to get in and start massaging the area yourself. So what we're looking to do here is to work into these sore bits. So what I can do is I know that these muscles run up and attach into the outside of my elbow. So what I can be looking to do is just to feel around. And what I want to do is to go through what I call a pin and stretch technique, one of my favorite techniques. So as I push around in here, and if I find a sore bit, typically we know that we got the outside of the elbow here, and if we trace a line back to the middle of the wrist, that's where you might find some of these sore parts. Once you find one, just press and hold on to that. And at first that's going to be quite sore, but you'll find that muscle starts to desensitize. So after about 30 seconds or so, what we can look to do is, once we've pinned it, then we look to stretch that muscle. So I'm taking that wrist into flexion like we were doing those stretches, and we're just working that muscle through. I might then work the muscle tissue, loosen it up a little bit, and go and find another one. You can repeat this process for 2 to 3 minutes. I would recommend this every other day, giving yourself a day off in between just to check that that isn't too sore and allowing that tissue to recover from the manual work that you've been doing. So, tip number 4 is that you can utilize a natural anti-inflammatory, that is ice. I mentioned that the pain in the elbow is caused by the effect, it's the problem, it's where we're symptomatic. We can manage that by applying ice for 5 to 10 minutes a day on that sore area. Remember, we're only managing the symptoms here, we're not actually correcting the cause. So don't just do that, we use that in conjunction with some of the other things that we've already spoken about and the final 2 tips that we're about to speak about now. So, tip number 5, what we want to then be doing is making sure that we're actually assessing not just the elbow, but some of the other joints, and in particular the shoulder joint. So the elbow, I think a little bit of like the knee. It's symmetrical to the knee, and a lot of the times our knee is the joint that's beaten up, and that's exactly what a lot of the time is happening here. Now, we've spoken about massaging these areas, we've spoken about stretching at the wrist joint, we've spoken about strengthening at the wrist joint. But don't forget the shoulder. A lot of the time I find with something like tennis elbow, and very typical in tennis players who are suffering tennis elbow, that the problem may have begun at the shoulder. So the first thing I would encourage you to do is to check the mobility of your shoulder on the problematic side. How do we do this? Well, I do this by doing what I term the reaching up and down the back test. So what I would encourage you to do is take your non-problematic side first. So if your problematic side is on the right hand side, you've got elbow pain on the right hand side, take your left arm. What you can firstly look to do is reach up your back. Then take the problematic side and do exactly the same. Do you find a reduction in that movement? Can you not get as high up? So for me, in fact, my right hand side feels much more comfortable than my left hand side, as I know I have reduced mobility in my left hand side. So if I was suffering left hand tennis elbow, that might be an indicator that I've got an issue at the shoulder. We can then do the same thing, reaching down the spine. So looking to see how far we can get. And again, if we feel that restriction, it's another point that we have an issue at the shoulder that needs addressing. Now, that in itself could be another video, but feel free to check out our channel where we talk about addressing shoulder mobility. But those tests themselves can straight away become a nice simple stretch for you to do. So if you found that movement to be difficult, we can hold that position for a stretch. Likewise, same thing there. And my final point around helping you with your tennis elbow is to think about the amount of grip strength that you're placing on the activities that you're doing. So, and can we modify that a little bit? So for example, if it is a tennis player who's suffering this, and why do tennis players get this frequently, hence the name tennis elbow? Well, because they're doing a lot of wrist extension and flexion and extension movements. So a lot of intricate wrist movements that can aggravate that. But if we know that we're a tennis player and we're suffering with tennis elbow, one of our tips might be to add a second grip or an over grip to your racket, because that's going to soften the grip and mean that you don't have to grip so hard on the racket. But again, that can apply to everything in your everyday life. So if you're somebody who's doing manual work, for example, can we soften the amount of tension that we're placing? Can we use grips? The other thing that you could do is use a support on the area to take away some of the strain from the sore point. But when it comes to supports, I'd encourage you only to be using these when you're doing these manual tasks and not when you're not, because what we want to be doing is correcting the problem. But can you be adjusting things about how you're doing your everyday life to reduce some of the soreness? If it's items like picking up the kettle is problematic, can we do this by first grabbing something like a rolled up tea towel to soften the amount that we need to grip? So I hope that makes sense. I hope that's given you a clearer understanding of actually what tennis elbow is, how you might be able to be deciding if it's something that you're suffering with, but if you are suffering with it or soreness around the elbow, how you can take these 6 tips and put those into correcting your pain. If you think that's been helpful and it's going to help you to suffer your, to resolve your tennis elbow, do me a quick favour and hit that like button. And if you found this content to be interesting, informative, why not subscribe? So what we've got here is another video that you could be following, and there's my face to help you subscribe to our channel. And I look forward to seeing you on the next one.